All right, a lot of people will probably identify with this segment. We're talking dental anxiety, and Dr. Ashley DeMarco of Gulfside Dental joining us now. How are you doing?
I'm wonderful. How are you?
Good, thank you. Good to have you. Now, this is something, like I said, that I really think a lot of people identify with. What is dental anxiety, the best way to describe it?
Pretty much just any fear of going to the dentist. It's any reason that will stop you from going, whether it's pain, embarrassment, or just afraid of, because you maybe had a bad previous experience, anything like that.
Kind of your nerves, I guess, whenever you're just really concerned about it. And what actually causes that? Of course, you mentioned some of those things, maybe probably a bad experience that could really make someone anxious.
Right, and actually, believe it or not, most adults that are afraid to come to the dentist had a bad experience as a child.
Wow.
And it's because maybe the dentist didn't take enough time to care, the kid was afraid or whatever it was. So, but we don't want those to be reasons that stop you from going to the dentist, because if you let the problems get worse, then you have more problems and even more reason to be afraid than you did before.
Absolutely, because I guess as you get older, of course, if you're not doing things really could be painful, if it's not taken care of. And what are ways that really a dentist can ease the anxiety, I guess, kind of just making it more comfortable?
Right. Well, we like to say the very first thing we try to do is to explain things. So you know what to expect, what I'm going to do, how long it takes, should you experience a little bit of discomfort, that type of thing.
Okay.
The next thing we do is we try to distract you a little bit. So at Gulfside, you'll notice there's TVs on all the ceilings, and you can watch a movie or your favorite sitcom TV show.
Wow.
We have a whole bunch downloaded you get to pick, and hopefully if you can just pay attention to the movie and not me, it'll take your mind off of it.
Yeah.
If that's not enough, we have different medications we can use. Anything is easy as nitrous oxide, which is a laughing gas, to medicines that you can take that we can prescribe you.
Okay, so that's really part of, I guess, if there's a severity in the anxiousness,
right,
that would be something they would need to talk to you about.
Exactly.
And I can understand how the TVs would be distracting, because if you're just lying there listening to all the noise of whatever machine, kind of gets nerve-wracking.
And some of the worst parts of dentistry is actually the sounds. Then actually you might not feel any pain. You're usually numb.
Yeah.
So, but the sounds can be kind of weird and just uncomfortable.
Yeah, exactly. The imagination definitely can take you away too. Tell me how someone can actually get a hold of you and maybe set up a new patient, or if they just have questions overall about what they need.
Well, they can call. We have our number we'll post after this, and they can talk to us about what they think they might need. If they know they've had a fear before of the dentist, like I said, we do use a lot of nitrous oxide, the laughing gas, to ease your fears, but we can also prescribe some of the anti-anxiety medicines that will, if you need a next step up, that can also help you get through your procedures. Because
really, of course, how often should you be going to the dentist, honestly?
Okay, so everyone, adults, after 3 years of age, or 2 adults, should be going to the dentist 2 times a year, unless you've been told to go more. But most people need to at least get their cleaning and updated x-rays twice a year, every 6 months. And then if you're under 3, we like to see the little kiddos every 3 months, just to check how their teeth are coming in, their growth patterns, that kind of thing.
And you actually see infants rather, starting at 6 months?
6 months. We see 6 months on up. So.
Okay, great. Thank you. We appreciate that. And of course, that phone number that was on the screen, we'll have that on our website, Fox 4 Beaumont. Have this entire segment. Someone can refer to it that way as well.
Perfect. And don't be afraid to come see us. We'll make sure you're comfortable.
There you go. She said it. Thank you, Doctor. We appreciate it. Stay with us. We'll be right back.